So HIV prevalence in Kenya has steadily reduced. The latest Kenya AIDS Indicator Survey put the HIV prevalence at 5.6%. ARVs are very accessible currently in Kenya. We find that the government and also the non-governmental organizations are able to provide these drugs for free.
You touched my heart.
I touched your heart.
In fact, I was even telling other guys, if it was not for George, mimi singekuwa ninaishi leo. Exactly. Exactly.
I've lived with HIV for the last 9 years. Initially, it was not easy because I thought I'll die in maybe a month, 2 months' time.
Please remember to be taking your medication on time. And the exercise part of it.
I got much information about HIV from George and I gained courage. But with time nikaona hiyo mawazo ya kukufa kumbe ninaweza kuishi tena.
I've managed to live for 17 years with HIV by following medication and treatment. I visit the community probably once or twice a week. Some of the messages I take while in the community is, for one, is to encourage them to seek these services because they are there at Ambrose for free. I also take that opportunity to portray myself as a role model in positive living. HIV has medication and one can live as long as possible with the virus.
Health service provision in Kibera has dramatically improved over the past few years. Since the HIV project began in 2003, we have managed to enroll a total of 8,500 patients into HIV care and treatment. Approximately 60% of these have been put on ARVs and 6% are children. We also provide prevention of mother-to-child transmission of HIV, and currently our transmission rate for the mothers who follow through is 0%. TB is the #1 killer among our HIV patients, and even for us at our facility, that is the current situation. So we are doing a number of interventions to reduce the burden of TB. During the routine visits by the HIV patients, we are able to do active TB screening for them, and for those who are suspected, they're able to be tested and diagnosed very early before the disease causes a lot of morbidity. Kuna mtu umekuwa naye ambaye alikuwa na TB ama anakohoa sana ambaye
TB nilikuwa nao kantibu.
We have a youth clinic where we do HIV testing for that youth population, and also we have special days dedicated to the youth, so we book them on specific days where they can get a lot of attention and we're able to address all their issues. In addition, all the new patients undergo nutrition assessment and counseling, and based on the assessment, which involves assessing their body mass index, we're able to select those who will require nutritional supplements.
Initially, there was very high rate of stigma in the community. Currently, because majority of us have come out openly and have sensitized the community, and the community has gotten aware that actually HIV is a terminal illness just like any other, and it has medication. It has helped reduce stigma and discrimination.